We made that decision to support transferring health.
We believed that we could provide better health services to our own people.
You need to know your culture, have a connection back to the land.
It was definitely a race. To October 2013, we transformed into the First Nations Health Authority. That was the day that the world changed.
Transfer all federal programming and funding to First Nations control. That was a huge undertaking.
They tried to take the Indian out of us, and it didn't work.
We're accountable to the people instead of being accountable to somebody in Ottawa. We've turned things around.
So the system change that we've been working towards is to flip it on its head. It's now nothing for us without us.
It's a real sense of pride and ownership.
2011, we had just signed the tripartite First Nations Health Governance Agreement.
For every significant step in this journey of health, we've been able to mark it in ceremony.
As leaders, we can tell that the future is going to be different.
Everybody in our communities needs some kind of healing.
Healing and the recovery for sure is critical for us to be able to be self-determining, to manage our lands and resources the way that we need to.
The vision of the First Nations Health Council, someone chuckled and said, "How did vibrant get in there?" What does vibrant mean? Somebody who's vibrant, there's light around them. They're not lost in shadows.
We see a lot of addictions in our communities, and it isn't the drug that we need to consider or the alcohol. It's what are the underlying issues, and that all gets encompassed in mental health.
There's so many things that we've suffered and struggled through. Inherently feeling shame for so many things and not even understanding why. That's not vibrant.
We recognize the damage that is done, but also the resilience of our people.
One of the biggest things I look forward to is understanding how we all look as vibrant people.
Healing is a key priority for all of our communities and our nations in order to be able to move ahead.
What we aspire to is part of something that our ancestors lived. I lived, and our hereditary chiefs, they were taught those kind of things to look after their Ha'otli. Ha'otli is land, resources, and people.
And I think of the traditional teachings of our elders in our Secwepemc culture. Women were the leaders.
Culture is a determinant of health. We've got at least 35 unique linguistic dialects in BC. Defining wellness in our own terms from every cultural lens means maybe 35 different versions of what well-being is. When we actually understand our language, we know how to govern.
We need to go back to our languages and our culture. They're in our land. We just have to remember.
This concept of nation rebuilding is one where we're healing our people from the impacts of the residential school.
Nation rebuilding is so important, building upon the strengths we have.
The 7 directives come from chiefs and leaders. And so it's important that we make sure that the work is community-driven and nation-based, that it increase First Nation decision-making, that it improve services, that we bring all of those decision-makers together that have a hand in the work of supporting healthy communities, that they're at the table so we collaborate and partner with others.
All of us move forward, become self-determining in that true sense. The real role is to actually help change the world, and that allows people to make their own realities at home.
First Nations leaders across this province in the various regions have designed how governance looks for them.
We're supporting our leadership to redevelop those institutions that routinely took decisions that Indian agents or social workers take for us today.
Don't let people tell you how you're going to be structured. Just do it.
The purpose is to ensure that we have healthy children and families. Those things are fundamental to nationhood.
Our vision statement speaks to being vibrant. So we want every nation to define what a healthy, vibrant youth is.
Doing our responsibility to look after the people and to look after the land in whatever ways that the Creator provided us to do that work.
through health and wellness, we're helping to lead or demonstrate that there can be change.
And who's responsible for that change? We are!